Thanks for joining me on New Jersey 101.5. Now, you are a senior vice president at Horizon and a medical doctor.
Correct.
All right. So, good morning, and I appreciate you taking the time. I know you're a busy man. I want to understand from your perspective, what is this claim from Catholic hospitals saying that they have been excluded and that there was no criteria when you made this decision to separate hospitals into Tier 1 and Tier 2, and it will be cheaper for the customer, the patient, using Tier 1. Explain it and tell me how do you overcome that objection?
Yeah, thank you for that. So this is really about responding to the consumer and the employers looking for lower cost of health insurance given sort of the challenges we've had. And the biggest issue here is trying to get at the waste in healthcare. 30% of the dollars that we have get spent on healthcare for repeat testing. People don't take their medications and end up in the emergency room in the hospital costing a lot of money. So we set up a series of criteria that looked at all the different hospitals and physicians as systems in our network and said which ones not just provide a quality of care that we're proud of, because we're proud of every hospital and every physician in our network given the quality of care they provide, but which ones are going to really fundamentally transform how they do business so that they're not taking care of patients in the hospital anymore, but they're doing everything they can to keep patients outside of the hospital. So the criteria were set up not about how good is Holy Name or how good is any hospital in terms of what they do inside the operating room or inside the inpatient setting, but fundamentally what are they doing to make sure that those patients are getting care before they ever set foot in the hospital. So those are the criteria that establish the different relationships we have today as part of the Omnia Health Alliance.
Doctor, let me ask you, why not then just make the call to Holy Name and these other Catholic hospitals and others, and not just Catholic hospitals? I say that because they seem to be the loudest voice of criticism here. And just give them a call and say, hey, by the way, we're doing this. Because, how do you address them saying we were just never contacted? We had no chance of putting up our good stuff and letting you know how good we are with outpatient care.
That's a great question. So we've been doing business in the state for 83 years and have a very, very good sense because these hospitals and physicians have been taking care of our members, almost 3.8 million members now for that entire period of time. And so we have a very good knowledge of what the different scope of services that they offer. All the criteria that we used from a quality standpoint were objective criteria that the government uses at CMS. So frankly, 75% of what went into the entire process were objective criteria that were done in a process that didn't require conversation. Not just the Catholics, but even the Tier 1 facilities and physicians that are part of the system.
And there is a Catholic hospital, St. Joseph's, right, that is in your Tier 1.
Absolutely, and that's a great point. We did not use tax status, religious affiliation, or any other metric that would discriminate against any religious group one way or the other. We put them through the process and the criteria, and the outcomes were the outcomes.
All right, Doc, let me ask you this. Now, the politicians are all up in arms. 8 hours. I don't think we haven't seen them that busy for a long time, other than going after the governor on Bridgegate. They were really busy.
My bladder was tested, for sure.
I bet it was. So what do you say to these guys? What's going to come out of this? Is there a real investigation? Are they just throwing it out there and trying to create a controversy from nothing?
Listen, we understand the legislature's role here in terms of making sure that what happens in healthcare and anything in New Jersey protects the consumer and that everyone's interests are balanced. So we welcome the opportunity to have the dialogue. We're hoping that they understand that this is about the consumer. It's about the employer who's really struggling with the cost of healthcare. And that, frankly, we're proud of every hospital and physician that's in our network. And we look forward to working with all of them to create further innovation and trying to keep our patients and members healthy.
All right, Dr. Minalkumar Patel, thank you for joining me on New Jersey 101.5. Appreciate your perspective and that you addressed the concerns that some have raised